You're now listening to the Lunch and Learn with Dr. Barry. This is episode 3.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome, it's Dr. Barry, and today's episode is titled, Why Do Men Die Younger Than Women? Now, this is a question I actually get in my office quite often, especially from men who don't understand why there seems to be so much more women around. And even though I give them about 5 to 10 different reasons, a lot of times they still have trouble grasping it. So I wanted to kind of, add a little spice onto Men's Health Month, which is in June, and give some top reasons why men keep dying. And a lot of it you'll see will point right back to the fact that a lot of them just don't like to come see the doctor. When it's all said and done, they really don't like to come see the doctor. And a lot of the reasons why, I have some theories, but for the most part, I think they just don't like seeing the doctor, and that's why they die younger. So take a listen to the podcast and enjoy. Hello, welcome. It is Dr. Barry, your favorite board-certified internist, founder at drpiersblog.com, author and speaker. Today we're bringing you a great lunch and learn. Today I'm going to be talking about why do men live. Live isn't a better word. Why don't men live longer than women, right? And that's a question I get a lot. I'm going to talk about 5 points today. They're not all 5 inclusive. But we're going to talk about 5 points today of why do men, die at a much earlier age than women. And there's lots of reasons. There's even, more. I'm going to touch on about 5 of them today. And on the blog post that I do later on, I'm going to touch on 5 more that I'll have a PDF version if you guys want to print that out on the website. So again, today we're talking about why do men die at a much earlier age than women. And as a physician, especially as a primary care physician, this is a topic that is very important to me because again, I'm trying to get my men to come into the doctor's office, and two to kind of live longer. We've got enough troubles as it is, and we're having a hard time kind of keeping up, just trying to stay alive, right? And when I did some of my research, it was very telling and really kind of made some sense of, why we're kind of behind on the 8 ball, right? So first and foremost, right, number one, right, reason number one why men, die at a much younger age than women is that men tend to take much bigger risk, right? And that's important, right? So we talked about men being the risk takers of the gender, and in that like setting of taking more risk, the problem is we do a lot of boneheaded things, and we tend to die of like a lot of accidents at a much earlier age. From a scientific standpoint, it's been shown that the frontal lobe, the part of the brain that actually controls judgment and thought process, actually grows a little bit slower in boys than in girls. And, what does that entail? That it tells that boys tend to not think very clearly, which a lot of you are probably like, yeah, we already knew that. And because of that judgment aspect of it, they make decisions that unfortunately cost their life, right? So number one, right, they tend to take a lot more risk than females, pretty much. And of course, obviously, when we get older, that kind of statement kind of holds true throughout. So that's an important concern as far as, why, that's one of the parts. Like I said, there's plenty of them, but that's one of the ones that I wanted to kind of make sure I touched on the first. Second one, reason number 2 is, and this is an important one, that suicide, right? And this was very telling and unfortunate, very stat, is that suicide happens at a much more frequent rate in men than they do in women. Now, a lot of you may be saying, well, I thought, women tend to be more depressed. And I thought, a lot of you may be like, that may be some of your reasoning. But what we've shown is that for men who have a lot of undiagnosed mental health issues. And then one of the points I'm talking about later kind of delves right into is they don't tend to seek any treatment. So men can be just as depressed, and a lot of them from a figurative standpoint tend to be just as depressed as women. But because they don't seek help, because they don't attempt to seek help, their issues kind of manifest to the point where they end up taking their life. And we do know that men, when they are attempting suicide, they go full out. So when they attempt suicide, they go full out and they actually commit the acts. Now I was looking for numbers to see, who commits because there's a lot of acts that get committed from suicide, but a lot of them are more attempted suicide. But men, when we go, we kind of go all the way out, and then we end up, fortunately, either shooting ourselves. By death by gun is probably one of the top causes for that. So that's what tends to happen in that standpoint when we talk about suicide being a factor of why men, die a little bit younger than women, right? So reason number three, right? Reason number three for why men die at a younger age than women, pretty much across the board. And this is an important one, especially for my cardiologists out there, is heart disease. Heart disease affects men at a much more rampant rate. Heart disease affects men at a later stage. And the reason why I talk about a later stage, again, and I'm kind of leading up to my next point, is that by the time a man gets, especially on average, not saying all, because I know I don't want you to all me, like I'm not saying everyone, but by the time the majority of men come to see the doctor's office, their blood pressure has been, out the wazoo for a much longer period of time. Their cholesterol has been out of control for a much longer period of time. I think the numbers, and we'll talk about the numbers, are staggering as far as the amount of men who just who don't go to see the doctor, right? And that kind of segues right to reason number four. Reason number four of why men have a younger and a shorter lifespan than women. And this is the thing that, hurts me, is that men, really just avoid doctors, right? They avoid seeing doctors. They avoid going to the doctor's office. So all of these concerns and things where they should, be seeking help, they don't do. So they don't get their yearly checkups. I think I read one stat, and I remember it was, 1 in 4 men avoid seeing the doctor for years. 1 in 4 men. That's a huge amount of men who are running around with uncontrolled medical conditions, including blood pressure, diabetes, high cholesterol, and all of these on top of the other issues that you can have. That's a huge amount of men that are running around. And of course, if you ask them, they say they have no medical problems, right? Like, it's always a funny thing. Like, I have no medical problems, but when I ask them, well, when's the last time you saw a doctor? They said it's been about 10 years. Well, of course you have no quote unquote documented medical problems because you're not going to see the doctor. But again, I don't know why we think this way, but like for men, if we don't go to see the doctor and we're not told we have any problems, in our eyes, we don't have any problems, right? So of course we can see how that could be extremely problematic, moving forward, right? Especially when we're talking about healthcare, especially when we're talking about, trying to be better, right? Of course, this, for all, always, if you're listening to this now, this is, Men's Health Month, and in Men's Health Month, we're trying to kind of highlight all of these like factors that are playing a role in, getting men healthy, or what are the factors that are keeping men unhealthy, right? And that's like, I that was my number 4 choice. It's a huge one. It's one that, I fight with like constantly as a primary care physician. I know as one of my big things, one of my ends that, especially when I like to try to get my men into the doctor's office, is I always go after the wife, the girlfriend, the sister. Like, I always go after the female family member, and most importantly, to try to bring them in, right? Like, that's usually my go-to. Like, I have a lot of patients who I take care of their sister, I take care of their cousin, I take care of their wife, and I take care of their mother, and that's the reason why they're coming in to see me, right? So they're not necessarily coming to see me just to come see me, but I've allowed myself that in. I've allowed myself to take care of their family member that they kind of respect, that they kind of love, and that's been able to kind of get me in the ball game, right? So last but not least, right? Reason number five why men tend to have a shorter lifespan than women. And, this is, for those, if you've been following me for a while, like this is something that like irks my nerves, right? So reason number five is the smokers, right? Men smoke an exorbitant amount, especially and I was actually shocked, right? In the United States, right? About 15% of men smoke versus about 9% of women. Do you know worldwide that number for men goes up about 40%? So think about that. 40% of men are smoking cigarettes, and I don't have to go. You can check, some of my recent, blog posts and videos and podcasts. You can check those out to see like how much I talk about cigarette smoking and why I don't understand why cigarette smoking is still legal. Like I still don't. To this day, I have no clue why cigarette smoke is still legal, but it is because, it makes a lot of money from a tax standpoint. So, that's neither here or there, but it's important, especially as a primary care physician. It's important as a family friend and a friend just in general that, if you have anyone who is in 2017, like still smoking cigarettes, like, I don't know, pull them by the ear, hide it, do something. This is something, again, and I will tell you this, and again, of course, I'm not advocating for it, but if you said, Doc, would you rather me smoke a cigarette or some marijuana? Which one would I choose? I'm going to tell you to choose the marijuana. Like, that's how bad these cigarettes are, right? And for those who know, I'm a proponent of medical marijuana. Hint, medical marijuana. I'm a proponent of medical marijuana. But if you said, Doc, I can only choose cigarettes or, marijuana, what do you like? I'm going to tell you to choose marijuana because we know, like, it's not even like we kind of think that there's some issues with cigarettes. We know that there's so many problems with cigarettes that it has to be like we have to get done with. We have to take care of it ASAP. Like so that's I left that for last, right? Because I always go on my little soapbox tangents when I talk about cigarette smoking. But that's just because, like, again, in 2017, like I'm still shocked that we still smoking, right? I'm still shocked that that's still a thing, and I don't know why it's still a thing, but I'm still shocked that it's still a thing, and that's that's what I want to hit home with. Men, I'm talking to you guys right now, ladies who are watching. Appreciate you for watching. If you can, make sure if you're watching, listen, make sure you pass this on to your male friends, saying that Dr. Barry does not want you to be smoking any more cigarettes. I don't want anyone to be smoking a cigarette, but especially the men, because we already got enough trouble as it is. We already have enough trouble, just trying to make it from day to day with all of the other stressors that we're dealing with for life. And we can't sit there and add on something like cigarettes like to our problems, right? So again, like the crux of everything today is, why do men live shorter than women? And let me get this on here. So that's really the crux of the talk today. I'm just trying to dive in and like really hone in like on some like key reasons. Like there's a slew of other issues. Some thought about genetic being reason, and so there's a slew of other issues, and that's what we really want to get to the bottom of. But these, like, if you can only like listen to 5, if you can only hear about 5 of them, number 1, we take bigger risk. Number 2, we commit suicide at a much more frequent rate than women. Number 3, the rate of heart disease is much more rampant in us than it is in women. Number 4, and number 4 should be number 1, number 2, and number 3, the fact that we avoid physicians and doctors and the fact that we just avoid the healthcare system in general is the reason why women live longer than us. And the last but not least, and the fact that, again, Dr. Barry is on the soapbox and doesn't understand why it's still an issue in 2017, the fact that we're smoking cigarettes at such a ridiculous rate compared to women on a worldwide basis. Like I said, in the United States, it's about 15% to 9%. In the world, it's about 40%. 40% of men are smoking a cigarette. Like that has to stop, and that has to stop, and that has to start with us, right? That has to start with us. If we want to live longer, if we want to see the benefits of, the life that we're in, we have to like make those moves, and that's all we can do from here, from that standpoint. So again, thank you for checking out today's Lunch and Learn with Dr. Barry. Again, our topic was why do men, not live longer than women? And I hope these 5 choices, or hope these 5, answers, again, there's many more, was enough to kind of, get you started and try to get you in the right direction. And again, if it doesn't get you in the right direction, hopefully it gets a family member in the right direction. Hopefully it gets a friend in the right direction. Just someone. Like, pass this message along. And you guys have a great and blessed day. I'll see you later. Bye.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, Lunch Learn Pod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.